The head of the World Health Organization is now in the Democratic Republic of Congo. He's there to tell people personally that the deadly Ebola outbreak can be stopped, and he's appealing for aid at a critical hour.
So I came here to show that the communities in Ituri, North Kivu and South Kivu, that they're not alone, and that we are here to support, and we understand their pain, but we also understand that they have the energy and all that it needs to stop this.
There are new numbers on the outbreak from the WHO, 125 confirmed cases of Ebola in the DRC, including 17 confirmed deaths. Beyond that, the WHO says there are more than 900 suspected cases and more than 200 suspected deaths now under investigation. The virus has also reached neighboring Uganda, where officials are confirming 7 cases and 1 death. Linda, what brings the WHO director into the outbreak zone, into Congo?
Yes, solidarity with the people who are there. Dr. Tedros Adhanom Ghebreyesus on the ground, traveling to the affected areas, and he had a letter to the people of the DRC saying, I will not be managing this from a comfortable office far away. So the WHO, we know, has declared an outbreak of international concern, and today the WHO head said they're not getting the aid they need.
The kind of support we're asking, the amount of support we're asking is still not received. It's a third of what we asked we're getting in terms of funding. And I use this opportunity actually to ask the international community to increase their support so the health workers get the supplies, the protective measures they need, and they are protected.
We heard from the Africa Centers for Disease Control. They said that they believed that they had secured, David, $500 million in funding pledges, but now say those pledges have dropped to about $290 million.
A trickle of what is now needed as this outbreak continues to explode. There is some aid arriving, though, in Congo.
From the European Union, and we have some pictures of that aid arriving in these cargo planes. This is to a town that is at the heart of the outbreak, Bunia, in Congo's Ituri province. This aid expected to arrive over the next 8 days. We're talking masks, gloves, boots, medications, desperately needed. We're hearing stories of doctors who have resorted to wearing expired medical masks at this point. The U.S. State Department has said that they are giving another $80 million to the cause. But even if they get this funding, logistically, it is so difficult to get this aid in because there have been customs delays, issues with bad roads, unreliable communications, and then a population that is angry with health workers there over protocols for dealing with the dead that isn't in line with their customary practices there. And again, you're also dealing with a volatile region. Ituri province is the center of attacks from armed groups. We've seen key cities, including Goma, which has an airport there that has been used as a health humanitarian effort hub, and that has been taken over by rebel groups. That's creating a huge humanitarian crisis, mass displacement, even before this all started. So the WHO head also saying today that a ceasefire is needed if they're going to be able to get this aid through.
Yeah, imagine trying to deal with a massive health emergency in the midst of essentially a war. Quite something.
Indeed.
Linda, thank you.